The next one is Schistosoma. This is already in a fluke worms. Yes, we are in fluke worms. And first is the schistosoma. Schistosoma affects the kidney and the colon. It can also get into the bladder and cause the bladder cancer, directly connected with the bladder cancer. So people in about almost 90% who have bladder cancer, very likely to have this causative factor. It resides in stagnant pools of water, in ponds. Eggs are eaten by gastropods, mollusks, and crawfish. Larvae can also bite through the skin or penetrate through the skin and go into the blood and lymph circulation, can go into the organs, tissues, in the kidneys, liver, cause cystic fibrosis, varicose veins, and different skin manifestations, dermatitis. The cysts and fibroids in the uterus can also be the result of the infestation. These are the signs of the schistosoma, basically. And we go on to the next. Fluke is the liver fluke, which is called Opisthorchiasis, and chlorine. These are two conditions, and this is the liver fluke. It likes the liver. It actually eats the liver. It doesn't really eat anything else, and this is why people who are fasting and have the liver fluke will not get better, will not have good results of fasting, but on the other hand, will degrade and have poor consequences. So liver fluke comes from fish. It feeds on liver, manifests through GI symptoms. It gets the microbiome off, causes the hepatitis, cholecystitis, colitis, and other different conditions of the intestines and the GI tract. The eggs are shed into the water. Snails feed on the eggs, and then the larva crawls out of the snail and gets into the fish, and the fish can be either the end host or can also be intermediate host. The larva grows into the adult specimen in about 2 to 3 weeks, very quickly, and begins to multiply. It causes the severe muscle pain because it produces acidity. It produces the allergies, liver congestion signs, and liver involvement and liver toxicity with jaundice, bile colitis, headaches, insomnia, general intoxication signs. But it may also go without symptoms, really, because liver is so resilient and does not hurt. It does not show signs of being affected. It may not show those signs up to the point where it's affected to 90%. And it still be functional. And this is why we do want to support our liver by all means possible, which is hardly done when prescribed anti-parasitic protocol to a patient. Hardly ever that they support the liver. In fact, they hardly know how to do. They think that liver is a self-sustainable organ, and I've never, heard of it, never seen it. So the liver suffers greatly. As you can see here, liver is all eaten and has a lot of pus accumulation. Of course, it would have the opportunistic infection during the process, and it will create a lot of mucus and a lot of pus, a lot of liver toxicity that will also be manifesting through the skin as dermatitis and allergic reactions. So that is the liver fluke. Now is the lung fluke. The lung fluke that likes the lung instead of the liver. So everything is very much like with the liver fluke, except for that it prefers to dwell in the lung and cause the lung cancer kind of symptoms. It may even be confused for lung cancer, break the intactness of the lung tissue to a severe form with active copious bleeding, accumulation of bloody pus inside of the lung tissue. And those encapsulation can also be fibroid, looking like neoplasm and tumors. And like I said, can be confused for the lung cancer. Not only confused, but eventually it can cause lung cancer. It can mutate and begin that oncological process of being malignant. So this is what the lung fluke does. So we have finished going through helminths. Now let's look at Protozoa. There are a few of them. Toxoplasma is a Protozoa, Giardia, and a few little other species. Protozoas. So the concern with Giardia is that it lives in the bile ducts. It also affects the liver. In a common language, it's considered to be chronic diarrhea. You have Giardia, it's a chronic diarrhea. But it's more than that. It's beyond that. And it's not specifically diarrhea. that is like a very distinguished sign of this condition. There can be constipation. There can be the combination of the two. In fact, that is even more common than just the diarrhea. So it lives in the bile duct, and everybody is at risk, and especially people who live by the ponds, warm pools of water, and swim in the ponds in the stagnant water. And there are a lot of people who do that, and that can pass very easily, even from person to person with a direct contact. It's not like it has to go through the cycle of developing before it can get into the system. The actual parasite can jump from person to person, also carry the eggs from person to person, and it breaks all the barriers inside the body. So it can even penetrate into the breast milk. Imagine the mother who has Giardia would actually breastfeed her child with Giardia eggs or specimens directly. They are very resilient, and the chlorine doesn't even kill them. So the pools where you go in the public pools, think of Giardia can be there, and that no chlorine can actually destroy it. It lives up to about 30 to 40 days, and then it multiplies. It causes, in the human body, it causes vomiting, GI signs, the pain, the acute pain, episode of acute pain with a sudden relief. The person would feel like, oh, like stabbing pain right away out of the blue, and then a quick relief of it and not understanding what just happened. So if you know somebody like that, tell them that is a sign. It causes the headaches, anemia as well. The stool can be different, can be either constipation, can be the combination of the two, and the loose stool. One very distinctive sign is the nasal triangle, nose-mouth triangle, can be either very pale or even cyanotic, which is bluish, as well as skin dryness and maybe even cracking elbows, cracking heels. That could also be the sign. Low-grade, long-lasting temperature, light stools in color, because the liver involvement as well. Abdominal distension, bloating, presence of mucus, even the foaming mucus in the stool. Children, again, are very high risk. The diagnosis is very hard. Diagnostic techniques with a gastroscope go into the small intestine. They can actually find the living parasites. Dermatitis, allergies, night sweats. Child can have excessive sweats during the night, as well as the secondary infection like fungi, viruses. The lymphatic system gets clogged, and this is why the night sweats develop weakness, irritability, dryness, and thirst, excessive thirst, drinking copious amount of water. In fact, in many individuals with the effect of Giardia, as well as some other parasites, there can be spikes in the appetite. The appetite can be really intense, and person can think that they can eat a lot, but after a couple of bites, they would just not have further appetite for the food, or they would prefer some certain different types of foods like breads, flour products, or sweets. Parasites can cause the perverted appetite, something like plastic or wood or paper. People would want to chew on that and eat that. It's not natural, but this is what they feel like. So that means that the parasite is in there. Weakness, again, general toxicity signs. In children, it can be the poor development, tantrums, blue circles under the eyes, vomiting, loose stools. Generally, development of the child will be affected greatly by presence of any parasite. Especially the blood-sucking parasites have difficulty with developing of the speech, memory, and the attention, as well as the physical deficiencies, poor growth, for muscle tone, deficiency in nutrients, in vitamins. Those could be great concerns and great blockages of developmental process of a child. I think that parents are responsible for that. They need to definitely find just not taking things for granted. Always be alert, understanding these things affecting our health all the time, checking and making sure, not letting any sign or symptom go, thinking it's normal. When you see the child is not adequately growing or the responses are not adequate, the reaction, something's wrong, even as a baby or later in childhood, be keen to these signs, making sure that you are giving the best potential to your children. Okay, so I think at this point we've discussed the parasites species individually to each one of them. And let's just have some other things mentioned here. High-risk groups. So we need to make sure that our nutrition is adequate. What is adequate nutrition generally is a broader question. Talking about particularities will just take us infinity. So let's think of what it depends on, what the nutrition depends on. Our digestive power, this is what it depends on. And what our digestive power depends on is the adequate regimen, not the quality of the food alone, but the way we eat, the way that we chew thoroughly, the way that we consider the food, the times that we eat the food, the times that we don't eat the food, because not all the time is the allowance for us to eat the food. For example, nighttime is not a good time to eat food, but many people do that. Many people would even wake up at night and start eating. What does this indicate? Is that their system either overtoxic, or there's parasites, or their deficiency of nutrients that the body is experiencing, always requiring that. And of course, the emotional being too. For us to establish the digestion and optimize it to the adequate state, we need to understand few principles of the healthy digestion. And those are the quality of the food, excluding things that are not natural, at least the processed stuff like sugars and flours and things that are just not natural by nature. Excluding the animal products, because not only that they carry the parasites or create the favorable environment for development of those, but also because they affect our karma and because they affect quality of the consciousness that we have. Because of that also, and because it's not natural food for our body, it's just that we made it natural, or we made it look natural, and we adapted to it. However, there's ways to safely eat meats too, and that is under the condition that you cook them well, you combine them properly, and you don't eat them in large quantities. You eat only the checked and good quality animal products. You chew them really well. You eat them only little time of the day, not 2, 3, or 4 times. You don't combine them with carbohydrates, because that way you will undermine your digestive power, because they're not compatible for digestion, because the combination will weaken the quality of digestion inside the stomach. And the stomach is number one filter for parasites and for fungi and for viruses and bacteria, for any proteins and eggs and larvae, all sorts and levels of parasites in their hierarchy. They are proteins in their body. That means that they will be neutralized in our stomach. In fact, our stomach is acidic not for digesting the animal meat, but for neutralizing the negative effect of parasites, for killing and annihilating the parasites, the viruses, bacteria. That's what the acidity of the stomach is made. So the stomach is the filter, and the allergy is the result of the protein presence, or the presence of the alien protein inside our system, because our immune system only responds to the presence of protein with the allergy. It's not the carbohydrate, it's not the fat, it's only the protein that can cause the allergy. Once you've optimized your nutrition in the right way, and that means incorporating more of the nutrients, more of the oils, and more of the aromatic herbs, spices, this is what chases the parasites out. They can hardly sustain these aromas of the fresh fruit, of the fresh berries, and especially of the acidic fruit. The enzymes and the acids of the acidic fruit and berries, that's what actually affects the parasite in a negative way. I mean, chasing them out. And the aromas of the herbs, the spiciness of the herbs, something that makes our stomach produce more enzymes and digestive juices. That what helps us reestablish the proper digestion and reduce the amount of invasion of parasites in our system. So other things like walking barefoot, as well as checking your products, washing your foods, all the vegetables, and the high-risk groups, people who are exposed. And we're all exposed to different types of parasites, but we're less exposed if we take good measures, but we're more exposed if we don't. Everybody is in a risk group, especially children, elderly. And again, the lower the immunity is, the more susceptible people to those parasites are. And like I said here, with the helminths and worms, the first line of defense is our digestive juice. This is number one. It's not our immune cells The weaker the digestion, the more at risk you can be. Now there's a program that we would like to introduce. Different parasites require different means and modality of prevention and treatment. The personal hygiene and so on, we've discussed, but as far as healing and treatment of the parasite, that can be different because different types are affected by different herbs differently and by different other compounds in the foods and different other routines that we can undertake. And therefore, we put things together in a different sequence, aiming at different types of parasites simultaneously and then phasing that out. So we phase 1 week and we phase that out with different other herbs for the next week. And then we do it for the third week and we do it for the fourth week with the different herbal formulations and some other formulations that are indicated during the entire course of this month, considered to be preventative and therapeutic. But there are some cases, the cyst in the brain, that just don't have any other means but do the surgery on the brain. However, even some of those severe cases can also be affected and healed by the natural means. So what does the nature offer us for the parasites? This is a wonderful thing. Only nature knows how to deal with this. Only nature may produce products that can chase the parasites out of the body, not kill them inside the body. Those are bitter herbs. So any bitter and pungent herbs, or most of them, would actually produce the effect on the adult specimens inside of the intestinal tract. Those are bitters, some of them more intense bitters than others would produce different effects on different sites. And therefore, we're doing combinations of a few herbs, bitter herbs, pungent herbs, to aim the parasites inside the intestinal tract. Then we also aim at the egg and the larva stage. That is a little more challenging. In terms of natural remedies, what is most effective is compounds of the healing mushrooms. There are some types of mushrooms that have very strong and potent compounds, polysaccharides. And those compounds, they are very effective to even dissolve the fiber of the larva inside of the tissues. This is the phase that is not addressed by the medical professionals. And this is where the nature allows us to produce the desired effect by taking specific types of mushrooms. And they can be various combinations of mushrooms too, in order to produce even a better effect. Some of the larvae may still be lingering inside the tissue, but sooner or later that larva will start hatching and breaking through, and this is why a repetitive cycle of this program, anti-parasitic therapy, are indicated, because we never know that after one course we are fully clear and the infestation will not happen within the next few months. So if that happens, then we need to undergo that cleanse again. So if we do it routinely and timely, then the chances that we can clear our body from all the parasites in the course of time. By doing that at the same time, we do need to follow the preventative measures as well. So number one, best healing and therapy for parasites is the prevention, as is always. In order to stop something from continuing, we need to prevent the causative factor. That's number one. And then we need to address the effect or the consequence of it. And so what we need to do first is integrate hygiene in our life. All the furniture that we have inside our house, all the carpets, the beds, all the clothes that need always be clean, do the hand washing, take care of our pets, also make sure that they are not carrying the parasites, fleas. Even the fleas can cause the invasion of parasites because they're carrying the eggs and the larvae. So we don't want that to happen, because this is the case with the whipworm, for example, the hookworm, where the cats can get them from the flea, which is a big concern too. And then that will pose the threat to the human that has the direct contact with these animals in the home. And this is why we don't want to allow the pets inside the bedroom. Sleeping with the pets in the bed can only go under one condition, where you're 100% certain that your pet is parasite clear and doesn't have any. If your pet is outside pet and roams outside freely, you may want to reconsider letting that pet inside your kitchen or inside your bedroom. So those are preventative measures. And then going from there, we need to do the preventative therapeutic measures and healing measures with the different bitter and pungent herbs and spices. Spices are herbs as well, but not all the spices can be combined together. There could be some controversies. There could be some herbs that can affect parasite and can affect your system as well, in maybe not the very positive way either, as well as doing liver support. That is very important part of the parasite detox, is supporting liver. The bitter herbs, they already support the liver on their own. So nature is very smart being that already knows what our body needs. It needs the liver support and anti-parasitic cleanse at the same time. And therefore, it provides those herbs with a double effect. But we want to go further than that, and we want to support it even more. So our program is designed to banish gross parasites from the body and intestines, liver and liver ducts, muscles and organ tissues. Most programs are not designed to drive the parasites out, but to kill them inside and then let the body deal with it. But this is a dangerous way to go. It can produce some really bad effects and undermine the health of the internal organs, the liver, because the accumulation of that decaying substance inside our system is very dangerous. Even an ounce of protein decaying inside the body can cause a severe allergic reaction of the system. Imagine if we have 100 parasites, right, that just all of a sudden died within our system. Whole graveyard of parasites that are decaying. Of course, our body will just be extremely screaming for help. And after clearing out those parasites, even partially, the person will feel perked up and revived again. They will start feeling the true taste of life, of health, how it's supposed to be, how the human being is supposed to feel, being so creative and energetic, funny and cheerful and so positive. This is what the life without the burden of these parasites would be. Parasites is the first line for our body. The second line is the bacteria, viruses, and fungi. However, we pay attention to those more than we pay attention to the parasites. Medical professionals do that because it's easier to kill bacteria than the real parasites inside the body. Even bacteria in a smaller amount, and how much bacteria can there be? If that causes like the severe response of the body, like the temperature, toxication, and different other manifestation, weakness and fever, the parasites, they go longer way creating these problems to the humans. But on the other hand, they're very adaptable and they would not want you to track them down. But if, let's say, if they didn't do that, it would just be so unbearable to go through stress of these type of conditions. They die inside the body, not just digestive tract. I'm talking about tissues and other organs. Digestive tract, forget about digestive tract. Don't associate parasites and intestinal parasites, like they say, with only digestive tract. This is not even 1/3 of the problem, because see, like, let's break down the life of a parasite into 3 stages: the egg, larva, and adult. And only the adult and not all of the adults live in the intestinal tract. So that makes it like the smaller percent of the third of the entire concern, where you can connect the parasite to the intestinal tract. But the rest, our body is the aquarium for them. They're just swimming in this aquarium wherever they want to go. They want to go into the brain and eat some of your nutrients there. They go there, they return, they go in different organs. They sleep in the lung. For the breakfast, they go into the kidney. For lunch, they go to the liver, and so on. They continuously suck blood, and you're just suffering, not knowing what's going on with you. That's the reality. However, it's hardly trackable. But if these parasites die inside our body, then they will be trackable, but then there will be severe manifestation of the extreme toxicity in the body. And so our program helps you get rid of those sensations and negative experiences from parasites and their invasion. Invasion of parasite actually talks about the pollution of the body that actually flows from the mind not being able to take care of self, and that actually makes the person suffer, not only then mentally with the emotions, but with the physical body by predisposing the body being susceptible to parasites. And here, what our parasitic program provides you additionally. So we do it in a guided regimen because we do anti-parasitic flush that requires the extra support, and just generally to support participants and provide them with further knowledge and understanding of parasites and the extent of that, how they affect us, additional ways of avoiding these infestations and contaminations. So we do it in a guided mode. We do step-by-step instructions. We do the chat support. Nutritional regimen will be described and articulated to the finest detail, explaining why and what need to be done. And some principles of restorative nutrition you may be already familiar with, because some of you may have gone through our detox program where we actually introduced that restorative nutrition. Recipes we do provide. So please consider that and let us answer your questions. From this point on, I just want to encourage you for further research and investigation and incorporating this knowledge into your day-to-day practical life, understanding the threats and potential dangers of the parasitic invasions, the way that their cycle happens, and the seriousness of the situation, which is understated, misrepresented, underestimated. This can actually create the fundamental beginning for a lot of oncological conditions, as well as other conditions, pretty much of any types and sorts of conditions, even the cardiovascular conditions, the people not even connecting these things to parasites. They can be the results of the parasites. So this is how important and serious it is. I wouldn't say that there are not other factors. Of course, I mean, there are other factors that affect reproductive system, female reproductive system, but the parasites do affect them directly. Parasites do affect the reproductive function of the female reproductive system. Yes, they do. Some parasites live in the muscle tissue of the reproductive system, in the ovaries, encapsulate there and have the larva stage there, and they would develop the cyst and fibroids inside the female reproductive system. And they would probably be number one or number two causative factors for that. And other causative factors would also be fungi and the metabolic waste products and poor shedding, the poor quality of blood and poor quality of menstrual cycle. Viruses affect female reproductive system. Parasites do affect female reproductive system. Toxoplasmosis, for example, is a protozoa also that comes from not cats, it comes from fish, but the cat is the intermediate. That can actually shut down the entire function of the reproductive system in females. Parasitic invasion is a more common causative factor for the infertility in females than any hormonal imbalances. I would even go to say that. Tapeworms can produce the effect of extended belly. First, there could be some other symptoms before the belly gets distended. It can be either respiratory symptoms. Usually it's either rhinitis, sinusitis. It can be pneumonia, bronchitis. It could be some problem with digestion, psychological manifestations, emotional tantrums, or focus span. Later, it could actually develop into the distended abdomen. But those preliminary symptoms that actually precede the formation of distension in the abdomen can also be hardly noticeable, or it could be considered to be normal. Okay, well, my child is more emotional, shows more tantrums, and that's normal for many people. They think that it's normal, but in fact, it could be the result of that preliminary stage affecting the child that way. Natural remedies, number one, is the preventative measures, right? Then the nutrition. The unnatural products should not be present. The proper combination should be present. The good nutritional regimen should be present. It's not like finger foods anywhere outside. The food needs to be viewed not as entertainment, but as food. But once the parasites are in, we need to use the herbs and the mushrooms. Herbs and mushrooms. Various bitters and herbs are good for the parasites in their intestinal phase as the adults. For the larva, some of the herbs can also produce the effect, but mainly it is the mushrooms and mushroom supplements, and not just mushrooms, but can be mushroom extracts, but non-alcoholic mushroom extracts that can retain the viable components of mushrooms. In fact, mushrooms, they contain very active compounds that can break down the larva wall capsule and dissolve the larva. Different various mushrooms can be put in a combination, producing the effect on the parasites at the same time supporting the liver. And as well as the herbs can do the same thing. So the combinations of these natural remedies can produce the effect on the entire cycle of the parasitic invasion, not only on the intestinal phase of it, like medications produce only. As far as the routines, what we can do, enemas with bitter herbs, purgative measures, because everything from the system, from all the organs and tissues will funnel down, will drain down into the digestive tract, to the liver, and then be distributed to the kidneys. So we do need to make sure that our liver can filter things coming from the system in a best way, and this is how we support our system. That's all there is available naturally, but believe me that this produces the best effect on parasites because of the entirety of the approach and because of the natural state of this therapy. Natural remedies, they do not produce any side effect on our body. The understanding of the seriousness definitely need to be preached to medical students more, because when I was a student, I kind of intuitively knew it was a vast department, deep concern, something that need to be fully recognized and understood. And yet it was just presented to us in a very dismissive way in a few lectures, and then everybody seemed to forget about it. Then in my practice of allopathic medicine, I'm talking about the Western type medicine, I've never seen a specialist who would be concerned with this. Never. Initially, I asked people here and there, what happened? But then I stopped and I became the same way. I thought, okay, well, it's probably not a big deal, considering that we don't really witness much of this and we don't always think of some conditions as to be connected to parasitic invasions. Why? There's no evidence, or maybe there's evidence, but is it like a confirmed evidence? Hardly establishable. This is why doctors, they probably have parasites of their own and don't want to let go of their nutrition. And this is why they would have hard times concerning this problem, because to be guiding the person through something, you really need to be a professional in it yourself. And you need to really know what you do and you're talking about experiencing this on yourself. But most of the doctors, they wouldn't. So why would they advise something like that?
Allopathic doctors think it's a third world issue.
That's what they do. They say it's somewhere else, not us. Yeah, they think that way. Sure. But we always have people from third world countries come here, United States, on daily basis. Lots of people from different countries. It doesn't really matter how you call it. The fact is the fact. We're all humans. We're all susceptible. An American person is the same human, susceptible to parasites, same physiology, anatomy. What makes the difference is the term of the third world, which parasites don't know. They don't know what it means. It means nothing to them.
We thank you for your time. Thank you very much for joining us. Have a beautiful day.
Thank you, guys. Thanks for visiting.